Hi, everyone. My name is Dr. Michael Walden. You're listening to Ask the Blood Detective. Today's topic is pain and natural prescriptions. So I've been in the field of holistic nutrition for over 30 years, and in all of that time, also being a doctor of chiropractic, I've had the opportunity to see people with all manner of pain. So when people ask me, even health professionals, they'll say, what is the thing that worked the best for you in terms of how you manage your patient's pain? Of course, I hardly know how to answer the question because it depends on the cause or causes of pain. And as you'll find out during this presentation today, this discussion on pain and natural prescriptions, pain has many sources and works through the body in some fascinating ways and some mysterious ways. And I'll also spend some time talking about a large number of nutritional associations with pain and healing that have been shown to actually work in certain aspects of pain management. And I'll also speak about some of the laboratory tests that can help one figure out more accurately what nutritional means might be the best for them to manage their particular pain. So let me start with first giving you my contact information. As I mentioned, my name is Dr. Michael Wald, and I call myself the Blood Detective because I believe that laboratory work gives us a way to look deeper. And if we actually have some knowledge and training in nutrition, when we read laboratory work, we see more there than someone who does not have that training. And all of my podcasts, all of my Ask the Blood Detective podcasts are meant to turn everyone into their own blood detectives by teaching you some real practical knowledge such that you can have discussions with your healthcare providers so that you can advocate for yourself. And when they ask you, well, why do you want that test or why do you want this nutrient, you actually have an answer. Okay. My contact information is 914-552-1442, and you can email me with questions or comments on this or any other shows that I've done at 914-552-1442, and the website is drmichaelwald.com, drmichaelwald.com. So what then is pain? I mean, it's an understatement to say that pain is a complex and multifaceted sensory and emotional experience that serves as a protective mechanism of the body. It's also the body's way of signaling that something's wrong and requires attention. Pain can be acute, it can be chronic, and it can manifest in various forms, such as sharp, it can be dull, throbbing, aching. While it's often associated with tissue damage or injury, pain can also occur without any apparent physical cause or causes. So let's now focus in on different types of pain, because different nutritional approaches work differently with different types of pain, as do many physical therapies and physiotherapy means. They work differently and more or less well depending on different types of pain. So let's go through some of this. And remember, you can always re-listen to this podcast because, a lot of this information is not simple. And some things that we need to know are not simple. They may take a few repetitions until you really have a good command of it. So there are two primary types of pain. There's nociceptive pain and there's neuropathic pain. So nociceptive pain arises from actual or potential tissue damage and is typically localized. It can be further categorized into somatic pain, which originates from the skin, muscles, or joints, and visceral pain, which emanates from the internal organs, the viscera. So neuropathic pain, on the other hand, again, opposite nociceptive pain, there's neuropathic pain, which results from damage or dysfunction of the nervous system itself and may present as shooting, burning, or tingling sensations. Okay, so what about the nervous system and pain transmission? So the transmission of pain signals throughout the nervous system involves a complex interplay of sensory neurons. Those are neurons that deal with the sensations, neurotransmitters, and specialized receptors. When tissue damage occurs, specialized nerve endings called nociceptors detect potentially harmful stimuli and initiate the process of transmitting pain signals to the brain, where they're interpreted. So let's talk about several ways in which the nervous system processes pain. Well, we have the peripheral nervous system. So your brain is the central nervous system. And your spinal cord that's under your brain, think of that as central nervous system. And anything emanating out of that central nervous system is known as the peripheral nervous system, basically said. So in the peripheral nervous system, the process in the peripheral nervous system where nociceptors located in the skin, muscles, and internal organs detect noxious stimuli. And these nociceptors are activated by various factors such as mechanical pressures and pressure extremes or chemical substances released during tissue injury. And then there's the transmission of pain signals to the spinal cord. There are what are known as ascending pathways of neurons to the brain, and these ascending pathways convey pain signals from the spinal cord to higher brain centers such as the thalamus and the cerebral cortex. And along this pathway, there's various neurotransmitters that are secreted between the neurons in the synaptic space, right? We all learned this in basic biology. And these various neurotransmitters, including substance P and glutamate, play critical roles in transmitting and modulating pain signals. Okay, and what about perception and processing of pain signals in the brain? So upon reaching the brain, pain signals are processed in regions such as the somatosensory cortex and the limbic system. And this processing gives rise to the conscious perception of pain as well as emotional responses to pain. And then there's the aspect of modulation of pain signals, how they're modified. So in addition to the transmission, pain signals can be modulated at various levels within the nervous system. And descending pathways originating from the brainstem can exert inhibitory control over incoming pain signals through the release of endogenous opioids and other types of neurotransmitters. So we need to understand that pain is a very complex phenomenon that involves intricate interactions within the nervous system. And understanding how pain moves through the pain systems provides insights, I would say, into potential targets for therapeutic interventions aimed at alleviating suffering and improving the quality of life for individuals experiencing acute and chronic pain. So that's obviously why we're learning this. We want people to live better lives. So why and how do some people perceive pain differently than others? Well, the perception of pain is a complex and multifaceted phenomenon and can vary greatly from person to person. And several factors contribute to the differences in how one person compared to another, or how individuals perceive pain, including biological and psychological and social-cultural differences. So let's begin with some of the biological factors that have to do with how one person compared to another would perceive pain differently. So there's biological differences. They play a significant role in how individuals perceive pain. So there are genetic variations which can affect and do affect an individual's sensitivity to pain, as well as their ability to modulate and cope with painful stimuli. For example, variations in genes related to the body's natural pain relief mechanisms, such as endorphin production and opioid receptor function, influence an individual's pain perception. And furthermore, I want to say that differences in the structure and function of the nervous system can impact how pain signals are processed and interpreted. For instance, variations in the density of pain receptors, neurotransmitter levels, and neural pathways involved in pain processing can and do contribute to differences in pain perception among individuals. I think that's fascinating. And then, of course, there are psychological factors. So psychological factors such as cognitive appraisal, emotional state, attention, and past experience also play a crucial role in shaping an individual's perception of pain. So, for example, I got a tattoo. I went to Brazil to do it in São Paulo, and it took 9 hours on a chair. 1 hour, we did have lunch, and we had two 15-minute breaks. I went straight otherwise, and I was really in a zen place. I was dealing with the acknowledgement that I knew I had pain. With every time he touched my skin, it felt like he was going into the same spot over and over and over again. But I knew I wanted this done, and I knew complaining about it wasn't going to help me get through it. So I basically just bared with it. And it also gave me courage, because he's told me that he's almost never had a man sit out on this table for essentially 8 hours straight for a tattoo. And I always thought of myself as not like tough, like a real man, but apparently I am. And then it just made me welcome more pain in my workouts. My hill running, for example, which is arduous and so painful. I could acknowledge being in this painful place and still push beyond it, rather than before me backing down from it. And when I practice my negatives now in my workouts with my weights, that I can stay in that negative a lot more than I ever used to. And I'm much more present with the pain, because I simply know that the longer you hold negative, the stronger you're going to get, and the better your muscles are going to grow. So I just know that. So knowing certain things, my emotional state and my past experiences helped me deal with lots of different types of pain. So that's what we're talking about when we're dealing with these psychological factors. So emotional factors such as anxiety, depression, stress, and fear can amplify or diminish the experience of pain. And additional attention focused on pain can alter or heighten or reduce in some way perceived intensity of pain. And past experiences with pain, which I just mentioned, or trauma or chronic illness, can also shape an individual's expectations and not only beliefs about pain, but will influence their subjective experiences of pain. So a lot of pain and the way we internalize pain, that is up to us. Our responses to pain are largely up to us. And then there are social cultural influences of pain. So social cultural factors encompass social norms and cultural beliefs about pain expression, social support systems, and access to healthcare resources. Cultural attitudes towards pain expression and I would say tolerance can influence how individuals communicate and cope with pain. And moreover, I think social support networks and access to healthcare services can impact an individual's ability to manage and seek treatment for their pains. So I would say, to kind of like sum that conversation up and that part of the discussion, the perception of pain is influenced by a complex interplay of biological, psychological, and social cultural factors, genetic variations, nervous system function, cognitive appraisal, emotional state, past experiences, cultural norms, social support, all contribute to the variability of how people perceive and experience pain. Which brings us to the next big question. Do men and women, on average, perceive pain differently? This is a very interesting question. And of course, we all know that some women experience pain, let's say, better than some men, and some men experience pain better than women. But by and large, on average, are there any differences? So research suggests, from what I've done, the research that I've carried out, that men and women may exhibit differences in their perception and experience of pain. Now, while these differences are not absolute, as I mentioned, they can vary among individuals. There are several studies that have identified potential gender-related disparities in pain sensitivity and response. So let's talk about the biological aspects. So biological variances between males and females contribute to differences in pain perception. This has been demonstrated. Hormonal influences play a significant role. For example, estrogen has been shown to modulate the body's response to painful stimuli. Studies have indicated that fluctuations in estrogen levels throughout the menstrual cycle can impact a woman's sensitivity to certain types of pain. And additionally, genetic factors related to pain processing pathways may differ between the sexes. Variations in genes encoding for neurotransmission involved in nociception, which is the perception of painful stimulation, or endogenous analgesic systems could contribute to gender disparities in pain sensitivity. And among these, I think, are the sociological or psychosocial factors. So the psychosocial factors also play a role in shaping gender differences in pain perception. Sociocultural norms regarding gender roles may influence how men and women express their experience of pain. So, for instance, expectations regarding masculinity may lead men to underreport or downplay their painful experiences compared to women. Moreover, psychological factors such as coping strategies and emotional responses to pain may differ between genders. Some research suggests that women may be more likely to seek social support when experiencing pain compared to men. And what about the clinical implications of all of this? So understanding gender differences in pain perception is critical for healthcare professionals when assessing and managing patients' pain. Research has shown that women are more likely than men to experience pain, or I should say certain chronic pain conditions such as fibromyalgia and migraines. Tailoring treatment approaches, I wanted to say, based on potential gender-specific mechanisms underlying these conditions could lead to more effective management strategies. So while there are biological and psychological differences in how men and women perceive pain on average, it's important, I think, to recognize that individual variabilities exist within each gender group. And by understanding these differences, it's important, that's essential, I would say, for developing personalized approaches for managing pain based on the individual's unique characteristics. So, what are the 15 most common causes of pain in the body? Well, the number one, I would say, is musculoskeletal pain, pain of the back, neck, the joints and muscles overall. And then there's headache and migraines being number two. And then the third most common, I would say, in my experience, is nerve pain, sciatica, peripheral neuropathy. There's dental pain from abscesses or toothaches. And then post-surgical pain. There's cancer pain, arthritis pain, fibromyalgia, chronic fatigue syndrome, a TMJ or temporal mandibular joint disorder, irritable bowel syndrome, endometriosis, pelvic inflammatory disease, osteoporosis, and GERD, or gastrointestinal reflux disease. So those are the 15 or so most common types of pain, or conditions, I should say, associated with pain. And what about the 15 top medical approaches? Well, number one would have to be analgesics, medications like acetaminophen and non-steroidal anti-inflammatories, or NSAIDs. And then there is the opioid class of drugs. And then there's non-pharmacologic interventions like physical therapy, occupational therapy, cognitive behavioral therapy. And then there's alternative therapies like acupuncture, massage, meditation, nutrition. And then there's muscle relaxants. There are anti-inflammatory meds, corticosteroids, local anesthetics, nerve blocks, spinal cord stimulation, radiofrequency ablation, intravenous infusions, ketamine infusions, platelet-rich plasma, stem cell therapy, and neurolysis, or nerve destruction. So it's pretty basic and important to note that the most effective approach to pain management will often involve a combination of these options tailored to the individual's specific needs and conditions. And it's also important to consult with a qualified healthcare provider when you're figuring all this stuff out. And I should say now it's probably a good enough time to give a quick disclaimer that this information is for your educational purposes only. It's not meant as a substitute for sound medical or health advice. And the use or misuse of this information by the user is the risk of the user. Now, having said that, let's talk about nutrition and the nutritional influence on pain and healing from trauma. So nutrition, in my mind, plays a crucial role in influencing pain and healing from trauma. The body's ability to heal and manage pain is intricately linked to the nutrients it receives. A well-balanced diet certainly is going to help in reducing inflammation, promoting nerve repair, and supporting overall recovery from physical trauma. Conversely, a poor diet lacking essential nutrients, like proteins, for example, can hinder and will hinder the healing process and exacerbate painful syndromes. Understanding the specific ways in which nutrition influences pain, I think, and the healing process and from trauma is essential for optimizing recovery. So even if the disease and breakdown of tissue was not initially caused by nutrition, nutrition still has a fundamental role in healing. So that's why I am a dietitian and I'm a certified nutrition specialist, and I have a board certification and a master's degree in nutrition because nutrition is important to me. For those of you who don't know the rest of my credentials, I'm a doctor of chiropractic as well. I'm certified in acupuncture in some states. And I did go to medical school. I graduated medical school. I earned an MD degree, but I decided not to go through the whole medical school thing for another 5 years, practicing drug medicine. That just was not for me. Okay, so nutrition can significantly impact pain perception. So certain nutrients, like for example, anti-inflammatory nutrients like omega-3 fatty acids, what I wanted to say was that omega-3 fatty acids found in fish oil have been shown to reduce inflammation. Most of us know this already, which contributes to pain levels. So therefore, if omega-3s are an anti-inflammatory by reducing inflammatory mediators, that's going to help reduce pain and, of course, will speed healing. And also, additionally, antioxidants present in fruits and vegetables, they also combat oxidative stress, potentially reducing pain sensitivity. And conversely, diets high in processed foods and trans fats will promote inflammation, leading to increased pain perception. So let's talk a little bit about the role of nutrition in tissue repair. So adequate nutrition is vital for tissue repair following trauma. Proteins, I would say, are essential for rebuilding damaged tissues, making them crucial for healing injuries. And amino acids, the building blocks of protein, play a key role in the formation of new tissue. Moreover, vitamins such as vitamin C are necessary for collagen synthesis, which is integral to wound healing. And without proper nutrition, the body's ability to repair damaged tissues is compromised, and that's going to obviously prolong the recovery process. All right, so what's the role then of the immune system on repair and pain? So nutrition also influences immune function, which is closely tied to the body's ability to heal from trauma. Micronutrients such as vitamin D, zinc, vitamin A, for example, play pivotal roles in supporting immune responses. And a well-functioning immune system is absolutely essential and needed for combating infections that might impede the healing process. And conversely, deficiencies in key nutrients can weaken the immune system, leading to delayed healing and increased susceptibility to complications. And what about this gut-brain connection to nutrition? Well, emerging research has highlighted over the last few decades the intricate relationship between gut health and pain perception. The gut microbiota, or the microbiota, that is, plays a significant role in modulating inflammation and innate function throughout the body, or I should say immune function. Therefore, if we want to maintain a healthy balance of gut flora, that's going to help our immune system, because most of our immune system is in our small intestine, in the walls of the small intestine. And then we've got another 20% or so in the bone marrow, and then the rest of the immune system, one might say, might be in the liver, in the Kupffer cells. So just to tie this up, nutrition exerts a profound influence on pain perception and healing from trauma. And a well-rounded diet rich in essential nutrients supports the body's ability to reduce inflammation, promote tissue repair, and bolster immune function. Also, as I mentioned, a healthy gut is crucial for the management of pain and inflammation, because if we're not absorbing properly from the gut, we can't really heal anything. And if we have leaky gut, which is a degenerative condition of the small and or large intestine, or both, then we have all sorts of inflammatory mediators and foreign products exiting the small intestine into the bloodstream, causing immune reactions and all sorts of biochemical reactions due to those gastrointestinal triggers. All right, so what I'm going to do now to end this up is I'm going to go over 20 of the most important nutritional supplements for pain and healing. And of course, you need to recognize that each individual's nutritional needs in their given pain situation will change what nutrients they of course will require. So this list just happens to be an arbitrary list of the key 20 things you should at least have heard of and you should think about in terms of your considering healing options when someone presents to you in pain, if you're a practitioner, or if you're a client or someone in pain themselves, or you have a friend, you want to know at least these things. Vitamin D. So we know vitamin D is known for its role in bone health and also is crucial in modulating immune function and reducing inflammation, which can aid in pain management. And we want the vitamin D levels on the blood to be at least a 70. We don't want it to be only a 50 or anything between a 30 and a 50. That's too low. Although most practitioners, most doctors will say that even a 31 is normal, and technically they're not wrong. But we know that the higher the vitamin D level, the lower one's risk of all causes of morbidity and mortality. And then there's omega-3 fatty acids. So, omega-3s are found in fish oil and certain nuts and seeds, and omega-3s have anti-inflammatory properties by producing prostaglandin E3s, which help to combat the pro-inflammatory prostaglandin E1s, for example. And by reducing inflammation, the omega-3s help to alleviate pain and support the body's healing process. And what about turmeric, curcumin? So this turmeric contains curcumin, which has been shown to have anti-inflammatory and anticoagulant effects. And that will potentially aid in pain relief and tissue healing. And then there's the old favorite magnesium, which is involved in about 500 different enzymatic reactions. So basically, magnesium helps to relax muscles, so by reducing spasm, that can reduce pain. It also helps reduce the spasm of blood vessels, so they can vasodilate better, helping to deliver oxygen and carbon dioxide and nutrition to healing tissues. Thus, again, all of these factors and other attributes of magnesium help to reduce pain and promote healing. And then there's vitamin C. So as an antioxidant, vitamin C is critical for collagen synthesis, which is essential for wound healing and tissue repair. And by the way, the amount of vitamin C, I usually base that on a vitamin C flush test where I have a person stay home and near a toilet for about 5 hours. I have them take a level teaspoon of vitamin C powder and a half a glass of water every 30 minutes until they get diarrhea. When they get diarrhea, they stop, and the amount of vitamin C that they need to take throughout the course of the day is 2/3 of the dose that caused them to have diarrhea. And they do that, and that usually maximizes their vitamin C. Also, you can compare that test to whether or not it normalizes and creates the presence of vitamin C in the urine, because if you have vitamin C in the urine, that usually means that your tissue levels are saturated. And then there's glucosamine, often used to support joint health. Glucosamine may help reduce pain and promote collagen repair. It also, glucosamine is not only good for joints, but also helps to heal the gut. And then there are probiotics. So these good bacteria are known for their role in gut health, and emerging research suggests that they might also have anti-inflammatory effects, which could aid in pain management. And then there's bromelain, a digestive enzyme. So derived from pineapple, bromelain has been studied for its potential to reduce inflammation and swelling, and thus supporting the body's healing process. I personally prefer to use animal enzymes. They have a much wider pH range of activity. And these enzymes, if you take them with food, will help you digest your food better. And that's, of course, essential because you need absorption of food to heal anything. And if you take the digestive enzymes, whether they're animal or plant, but again, I prefer animal, if you take them away from foods by about a half an hour, they are going to help inflammation pretty much everywhere else in the body because there won't be anything to digest in the stomach. So the body just directs those enzymes into the bloodstream, and that can help reduce inflammation throughout the body. And then there's zinc, which is required for about 250 enzyme systems. It's essential for immune function. Most people have heard of zinc and immunity. Also, it's needed for wound healing, and zinc supplementation may help with tissue repair and recovery from injuries. So we know that zinc helps tissue recovery. The best test for that, that's probably one's response to zinc supplementation, but there is a plasma and a serum zinc test that tells you the amount of zinc the person had in the last 2 or 3 days. There is a zinc taste test, which uses a liquid form of zinc sulfate. A person would put a teaspoon of the zinc sulfate in their mouths and swish it around and immediately start timing themselves. And then depending on how long it takes for the person to taste either a fuzzy metallic-y or dry flavor gives us an indication of whether or not a person is zinc deficient, because the tongue is a tissue. So more on that on my website, which is drmichaelwald.com, drmichaelwald.com. And I might as well give you my contact information at this point. My email is info@blooddetective.com. You can call me at 914-552-1442. Okay. Habit Boswellia serrata, so also known as Indian frankincense. This herb's been traditionally used to manage pain and inflammation, and it's very effective. There's no specific test for it other than maybe giving a certain amount of Boswellia and zinc or bromelain or whatever you're going to give someone. And if you've measured inflammatory mediators, the inflammatory mediators should reduce. And then there's vitamin E, another important antioxidant, fat-soluble antioxidant. Vitamin E helps protect cells from damage during the healing process. It also helps reduce scarring when applied topically on a wound. And then there's MSM. And what MSM is, that's a compound that's used for joint health, and it's been used to, it's been studied for its potential anti-inflammatory effects. And then there's ginger. Ginger, known for its anti-nausea properties, ginger also has anti-inflammatory effects that may help with pain management. And then arnica. Many people are aware of arnica, used topically to in creams or gels. Arnica has been traditionally used, I would say, to reduce pain and swelling associated with bruises, sprains, and other injuries. I'll give you a couple more essential nutrients for healing. L-glutamine. So L-glutamine, this is an amino acid that plays a role in protein synthesis and immune function. L-glutamine may support tissue repair and recovery overall, and we know it's the most abundant amino acid in the body needed to for the intestinal tract's lining to turn over. It's heavily dependent on glutamine. So glutamine is good for immunity. Glutamine helps to maintain what's called positive nitrogen balance, the protein balance in the body, which is associated with healing, inflammation, and immunity, among other things. And then there's chondroitin sulfate, often paired with glucosamine. Chondroitin sulfate is believed to support joint health and reduce pain associated with arthritis. So a person would need about maybe 1 to 2 grams of chondroitin along with glucosamine to help joint issues. If they malabsorb, then the person is going to need much higher doses to push that malabsorption. And of course, you want to fix the malabsorption. And then there's quercetin, which is a flavonoid found in many fruits and vegetables. Quercetin has antioxidant and anti-inflammatory properties that may aid in pain management. And then there's B-complex vitamins, including B1, which is thiamine, and B6, which is pyridoxine, and B12, which is cobalamin. These vitamins play various roles in nerve function, energy production, and tissue repair. One more, that would be protein. So adequate protein intake is essential for tissue repair and muscle recovery after injuries or surgeries. If I had to choose one nutrient that was the most important for tissue repair, it would have to be protein. But of course, there are other very important nutrients as well. But the protein amount for each person should be based on a bioimpedance test or a body composition analysis, which lets me know the number of grams of lean body mass on a person. And then I would base their daily amounts of how many grams of protein per day based upon their lean body mass, wanting usually to increase their lean body mass. And I should mention, too, that an increase in lean body mass, which is the muscles and the organs, is associated with reduced risk of dying of anything, and it's associated with an improvement in, or I should say, a greater chance of experiencing fewer symptoms throughout your life that could damage your quality of life. Okay. Thank you all so much for joining me today on this podcast presentation on Ask the Blood Detective, Pain and Natural Prescriptions. Please let me know your thoughts by emailing me at info@blooddetective.com. You can call me if you want to become a client at 914-552-1442, and visit the website for all sorts of free content and videos at www.drmichaelwald.com. Take care, everyone. Talk with you soon.